Good morning, Miss Islam. How are you doing today?
I'm well, thanks. And you, doctor?
I'm well, thank you. So, where are you from?
I'm from Silverton. I work there as a bank manager, actually.
I see. And how old are you?
I'm 55 years old.
Okay, so what seems to be the problem today?
So, doctor, I have noticed recently that some of my teeth are loose and my gums bleed when I brush my teeth.
And for how long have you noticed this?
I think for around 2 months now. I just feel quite concerned about it. I'm worried about how red and swollen my gums look, and I don't understand why it looks this way.
We are going to have a look and I will explain to you what's going on.
Thank you very much, doctor.
And do you have any medical conditions?
I have high blood pressure, sugar, and cholesterol, but I am taking medication. I brought my script along.
Great. So, you are taking simvastatin for cholesterol, Rirac and amlodipine for blood pressure, and metformin for diabetes.
So I think that's right.
And do you have any allergies?
No,
And how often do you visit the dentist?
I think I last visited the dentist when I was in my 20s. They did a cleaning, I think.
I see. Okay, you can just lie back and relax. I'm going to have a look in your mouth. Okay, so from the examination and looking at your x ray, I can see that you have a condition known as periodontitis. You have lots of deposits on your teeth from plaque and calculus buildup. Plaque is a sticky substance that forms after we eat, mostly after eating sugary foods. It harbors germs and bacteria that causes destruction to your gums.
Oh dear. So that means that I have a lot of bacteria.
Yes, when plaque stays there for a long time, it hardens to form a substance called calculus. And calculus has a rough surface which allows even more plaque and bacteria to attach.
That sounds awful.
Yes, the bacteria makes your gums inflamed, so you see redness, swelling, and bleeding. This is called gingivitis.
I think I have heard of gingivitis before. So is that what I have?
You have periodontitis. This is where the bacteria accumulates over a long period of time, which leads to the damage of the tissues that connect your gums to your teeth. And this leads to what we call pocket formation under the gums. Pockets are basically gaps under your gums that are not attached to your tooth, and these areas accumulate a whole lot of really bad bacteria that just keep on destroying the bone and the attachment of your gums. This is how periodontitis occurs. It progresses from gingivitis, where there's no bone and attachment destruction.
That sounds terrible.
Yes, if it's not treated, the bacteria will just cause more damage. Your bone levels will get lower, and your gums will not be able to hold your teeth. You could even lose some teeth.
Oh no, that would be horrible. So how can this be treated?
Firstly, periodontitis is a lifelong condition. It does not just go away, it requires regular treatment. The initial treatment involves removing the plaque and calculus, so we will basically be cleaning your teeth very well. We remove the deposits that are both above and below the gum level using specialized instruments. We will also be taking small x rays of each tooth to evaluate the bone levels. And then, after we clean your gums, we will call you in about 6 weeks to see if there has been an improvement. We also record the bleeding and plaque levels, which will tell us if there has been a change since the first visit. This will help us tell if the inflammation has reduced and will also indicate whether you have been cleaning your teeth well at home.
So I really need to pay more attention to cleaning my teeth?
Yes, the plaque and calculus accumulate when you don't clean your teeth properly. And the treatment that we provide mostly deals with cleaning your teeth very well. So if you also don't clean your teeth well at home, the treatment is not going to be effective.
I will try my best.
So if we see the pockets have improved and resolved, we will call you in for regular maintenance appointments every few months where we will clean your teeth for you with the special instruments. If you are cleaning well and there are still some pockets that are present, we will consider referring you to a specialist dentist will do a treatment to address the areas that are still infected, but this is only considered if your plaque and bleeding levels are under control.
Okay, I understand.
If the treatment is successful, your gums will actually move to a lower level, showing that the inflammation has resolved. Your teeth may look longer and may also feel sensitive, and this is completely normal.
I see. So I really have to pay attention to my oral hygiene. And will my gums look healthier after the treatment?
So, as I said, your gums won't ever go back to normal, and we will still see bone loss on the x ray because it won't just grow back. But clinically, your gums won't be so red and inflamed, and we won't be measuring any pockets. So, this will indicate that the periodontitis has resolved.
I see.
Also important is that periodontitis is a very complex disease and many factors are involved in its development. Other than poor oral hygiene, there can be genetic factors involved as well as medical conditions such as high blood pressure and diabetes that can contribute to periodontitis. It works the other way around as well, since periodontitis can exacerbate these conditions too. The things that periodontitis and these underlying conditions all have in common is that they are associated with increased inflammation in your body.
That's interesting. So one can worsen the other if either of them is not controlled.
Exactly. That is why we need to ensure that your blood pressure and sugar control. And by ensuring that your periodontal condition is under control, your diabetes and blood pressure are more likely to be stable.
That makes a lot of sense. Wow, I did not realize how complex my condition is.
One more thing to note is that you are taking amlodipine for your blood pressure, and this drug is called a calcium channel blocker. It may cause gum enlargement. In your case, the enlargement is not so severe, so it may just be due to the periodontitis. But this is something we will evaluate later on after we treat the periodontitis.